Good evening and welcome to Ask the Specialists here on CMU Public Television. I'm Rick Westover, your host tonight. We're asking the doctors, and they join us from Mid-Michigan Health. Get your questions ready, give us a call, and we'll talk to you soon. Thanks again for joining us, and I want to remind you we have a new telephone number to use, 844-975-3343 for Ask the Doctors here on CMU Public Television. Again, I mentioned that our doctors join us from the Mid-Michigan Health, and welcome, gentlemen. We appreciate having you join us on the show today. I want to first introduce Dr. Aboud Salibi, who joins us out of Clare. Your practice is there. Tell us a little bit about your practice and your time here in Mid-Michigan, because I understand you've been here just a few months from Ohio, was it?
Yes, I'm a board-certified internal medicine. I moved recently and I started my new practice up in Clare at Mid-Michigan Health Center. I did my residency in Youngstown, Ohio. I moved to Clare area mid of October, so it's been almost 4 months since I moved here.
Very good.
Yeah.
Welcome, and we'll get some questions to you here in just a minute, too.
Absolutely.
I also want to welcome in Dr. Ronnie Hanna, who joins us with his practice out of Harrison. And again, you're sort of the same situation, sort of a new deposit here in Mid-Michigan. We're glad to have you.
Correct, yeah. So I finished the residency up in Buffalo, New York, and I moved to the area in November. So I started up in Harrison and Mid-Michigan December 1st, and I've been working there since then.
Okay, and you both specialize in internal medicine.
Correct.
Yes.
Can you tell me what that is? Sort of explain that so our folks have a sense of what kind of questions we'll be able to field today.
Yes, internal medicine, usually we take care of adult patients, 18 and above, as a primary care physicians, and they count us as the family doctor for them. Usually we are the first stop for any medical complaints. We try to address and help with a variety of medical problems, such as heart problems, GI problems, and when things become complicated, we then refer to specialists, depends on the situation.
That's what we were talking about before, Dr. Hanna. We were talking about the fact that even though you're sort of like the hub, and then if some further consultation has to be done with a specialist, you still oversee that.
Correct. So we are like the maestro. We arrange care between different specialties, and it all comes to us as primary care providers, and we try to arrange different things with different providers. We also practice preventive medicine, which is also, in addition to taking care of the patient, also we play a role in preventing diseases with screening studies, and this is all what we do in our practice.
Sounds great. We're glad to have you joining us, and we'll start off with some questions here. And for Dr. Salibi, we have a question about bone spurs in a joint. What causes a bone spur in the joint, and is there any relief for that?
Bone spurs usually is the mechanism the bone defends itself because the patients or person been using the joints or overuse the joints, so the bones try to protect itself by overgrowing small pieces of bone. And with time, these small pieces of bone basically interfere with the mechanism the joint works, so it starts causing pain. Usually the treatment is try to prevent further damage, and we can start with a simple measurement. Depends on the joint actually. So it's really depends on what joint and how much it does affect the mobility and the function of that joint. But start usually with simple measurement, as I said, some minor pain medication, special training or exercises, and we can step up the treatment, depends on that.
All right, very good. Very good, thank you. For Dr. Hanna, a question about varicose veins and the process of removing them, and are there age limits for varicose vein surgery?
Sure, it all depends about the comorbidities of the patient. So if the patient had varicose veins and he is healthy or she is healthy and she is able to do her daily living, and if the varicose vein is limiting her ability to do things during the day, so it's recommended. And it's up to the vascular surgeons who can decide who needs a surgery or not. For us in the primary care, we do conservative management, including compression stockings to try to relieve pressure in the legs, and probably that will help, but further intervention need to be addressed by a vascular surgeon.
All right, thank you very much. For Dr. Salibi, we have a woman who has osteoporosis, and can that bone loss be regained through prescription medication, or is that bone loss permanent?
Usually, the goal of treating osteoporosis is preventing further bone loss. There's only one medication that's proven to help the bone to rebuild itself and form a new bone. And usually it's the very end of the line of treatment. Usually we treat it with vitamin D supplement and calcium supplement and other medication that help preventing further loss. That's the first line. And if the disease is very severe and the patient has a high risk to develop a fracture, we start that medication that would help the body build a new bones.
Okay, thank you. We have a caller out of Cedarville, female patient, or female, 78 years of age, and they ask, can I take ginseng for my fatigue following cancer treatment? And they also note I also have autoimmune hepatitis. Dr. Hanna?
Sure. I mean, ginseng is over-the-counter and is natural herb supplement. It hasn't been studied with enough studies and research
Sure.
to know exactly what's the effect of it. It has side effect. It can, I think, can cause platelet dysfunction, leading more high risk for bleeding. I am not sure if it's recommended actually to treatment fatigue as after cancer.
All right, thank you. A caller out of Cadillac, Dr. Sleeby. They have, has medical science come to a conclusion about what the appendix is used for? What purpose does it serve is the question.
Appendix itself is a lymphatic tissue, which is basically have white blood cells that's supposed to fight, or a first line to fight against infection. But I'm not sure if they found a definitive function for it, or because in many times it just can be removed and there will be no consequences on the patients.
Okay.
But as tissue-wise, it's mainly it's part of the lymphatic system.
All right, very good, thank you. Many wonder, I probably because you can simply, we always hear about the appendix coming out. So a caller from Mount Pleasant, Dr. Hanna, how long does it typically take a strained or sprained ankle to heal?
It depends on the severity of the strain, but usually with appropriate management, it should take at least 2 weeks till it start patients feeling better after the sprain.
All right, good. And is there anything that they can do to sort of speed that along, or is that going to process it? It'll just take 2 weeks approximately?
Usually it's like you need to use conservative management. You should not overexert your joint. You should rest it, take pain medications, anti-inflammatory medications, also with splint to help reduce the traction in the joint so it can help heal it.
Okay, very good. A reminder, too, again, we've got a new phone number that we're working with, so we want to let you be sure you know about that, 844-975-3343. That's 844-975-3343. You can also join us via Twitter at WCMU_AskThe and through Facebook.com/AskTheSpecialists. Dr. Salibi, a question from Sears, Michigan, about edema. First, can we identify what that is? And then she says, why does it become a weeping rash when they have edema?
Edema basically is...
And this happens to be a female 82 years of age, if that happens to matter.
Edema has many etiologies, but basically what edema is increasing the fluid in the tissues in our bodies, usually in the lower extremities. And there is different mechanism why we have edema, but any... if it's a generalized edema, then one of the main causes is the heart failure. Basically, the heart is not able to pump enough blood down from the lower extremities all the way up. And whenever you have a stasis, like fluid stasis, the skin gets irritated a little bit, and that's why that develop the rash and that burning sensation, generally speaking.
And the issue with the weeping rash, why does it become a weeping rash? Do you know what that might be?
I'm not sure what this is exactly she means with the weeping rash.
The phrase weeping rash, I'm not, Dr. Hanna, does that ring a bell?
I think the reason why the rash happens, as Dr. Salibi mentioned, is because the fluids, there's increased pressure on the skin.
Gotcha. I'm sorry, I missed that.
Okay, no
problem.
problem.
Very good. Out of Traverse City, there's a gentleman, 58 years of age, asks, are you familiar with inclusion body myositis? Myositis, thank you. Are you familiar with it? And then they're asking about treatments as well. They note some kind of series of treatments, 3 to 38. I'm not certain about that portion, but the inclusion body
Myositis.
Myositis.
Inclusion body myositis.
Yes.
So myositis is an inflammation of the muscles. Inclusion body and myositis is a kind of autoimmune disease that the muscles got inflamed. What's exactly the mechanism? It's not known. Most likely is the antibodies produced by the system start attacking the muscles. Now, this is far beyond primary care to being able to manage it. This is managed by specialists, especially rheumatologists. About treatment, I know that they use courses of immunosuppressant medications, sometimes steroids, to try to increase the inflammations and the symptoms of it, which is most likely muscle pain and muscle fatigue, and patients feel tired. But this is need to be addressed by a specialist.
Okay, all right, very good. Caller from Waterford, a male, age 31, asks what could cause CK levels to rise. They're hospitalized, but no diagnosis. What are CK levels referring to?
CK is the muscle enzyme, and to have a high level of CK in the blood, that means there is a damage caused to the muscle. Now, what might cause a damage to the muscle? There's a variety of reasons, starting with maybe medication, end up sometimes dehydration, sometimes some people with exercising, if they are doing a lot of exercises that involve a lot of muscle activities, their muscle will also be damaged a little bit and release these enzymes in the blood. So there's wide range of possible causes of this. Depends on case by case, it needs a lot of workup and investigation. But the treatment, usually we try to prevent the damage from happening again. We are worried about the kidneys because this enzymes is very hard to be filtrated by the kidneys, so they may end up causing kidney failure or so. So patients, usually we make sure they are getting enough fluid and a lot of dehydration, helping the kidney basically filter the blood and take this creatine kinase, CK stands for creatine kinase, out of the system.
All right, thank you. A question for Dr. Hanna about a rash on the testicles. We're talking, I believe, jock itch. There's a prescription. They're using a prescription, but it's not improving. Is there anything else he can do?
Unfortunately, I cannot do anything. He needs to be seen by his primary care doctor or his family doctor to take a look at it and see what kind of rash. There is different kind of rashes, and each kind of rash, it has different treatments, so I don't have enough information to answer his question.
Sure enough, follow up with your doctor.
Follow up with a doctor.
Okay. A question about what are the symptoms of measles in adults, Dr. Salibi, and other than standard, splotches and red spots. This is a female patient or female caller out of Howard City. How does measles represent itself in adults?
I'm not sure if I get the term right. The term of the disease, measles?
Measles.
The measles.
Okay.
The itchy, yeah.
Measles.
How does it present itself in adults?
It's very rare in adults because majority of the people will develop immunity through childhood, but it has the same symptoms or any viral syndrome, we call it, which basically make it develop fever, chills, fatigue, flat red spot on the skin. Sometimes you can even mistake it with maybe common cold or so, because all the viral syndrome show up in the beginning at the same symptoms.
Okay.
But what differentiated from others is the type of the rash that it shows up on the skin line.
Okay, all right, very good. A gentleman out of White Lake, 63 years of age, Dr. Hanna. I've got another tough one here. Osteomyelitis.
Osteomyelitis, okay.
What are the treatment options? How does it regenerate? And first of all, for most of us, what is that?
Okay, so osteomyelitis is an infection of the bone.
Okay.
Treatment with it depends on the pathology. Most likely it's bacterial infection. You need to diagnose it, you need to find what kind of bacteria is causing the infection, and then you need to direct that antibiotics against that bacteria. So it depends what site the osteomyelitis happened, and then the treatment is directed based on it. Let's say it happened in a finger or in a toe, osteomyelitis. The first treatment is to take that bone out. So you do amputation of the finger. And then you subsequent antibiotic treatment. And usually the antibiotic course of treatment is around 4 weeks. But again, there is no definitive answer at all based on the culture data, what we call it.
And he asked the question about regeneration. How and why might that be happening?
Again, it depends how bad is the osteomyelitis and how much the infection is extended and what did they do for the infection. It's an infected bone, so usually the bone does not have good supply of blood, so it takes some time to regenerate. But again, depends the extension of the disease and what did they do initially for the treatment.
Okay, thank you. Dr. Sleeby, out of Harrisville, a 75-year-old gentleman asking, what is the recommendation for healing time and care for broken ribs?
Treating broken ribs actually is simple and complicated at the same time. We don't treat it the way they treat any other bone fracture. You can't put it in a splint. You can't fix it. What we worry about is the consequences of broken ribs. Because with the broken ribs, patients will have pain with deep breath and any activities. So they try not to breathe that deeply, and that will put them in a higher risk to develop lung problem and infection. So as far as treatment goes, is to encourage the patients to maintain their level of activity, and we try to help them managing the pain with simple medication first, starting with maybe ibuprofen or Tylenol, and we can step that up, depends on the situation. A topical patch like lidocaine patch, we try to use it. It all works sometimes. It doesn't work sometimes. There is also some nerve injection. If the pain is very debilitating and the patient is really facing difficulty breathing because of it, we can try to inject pain medication at the nerve roots, assuming that the fracture is not very severe and caused internal organ damage, though. I'm talking about a simple rib fracture.
Okay.
So the problem is with the consequences more than the fracture itself. But the majority of the fracture end up unhealed. They're still just there. We deal with the pain mainly.
Okay, thank you very much. We've had a question come through on Twitter at WCMU_AskDa. Dr. Hannah, is Tamiflu safe to combine with other antibiotics?
Yes, because Tamiflu is antiviral.
Okay.
So it's direct and against influenza, and it's antiviral medication. So it's different than the antibiotics.
They don't
different
compete.
mechanism.
Okay.
There's no.
All right. Very good. Dr. Sleeby, a question out of Alpena. This person says, my great-grandmother is almost 100 years old. Her physician is recommending hip replacement. Does that sound reasonable? She is healthy overall.
Yeah, exactly. It's case by case. You know, for a 100 years old patient who is active, has her own life, maybe surgery is a good option for her because a broken hip has a high mortality. With a broken hip, the patient will be not able to move as she used to be. She will be bedridden sometimes, and that put her on higher risk to develop more medical problem as a consequence. So if she's has a good health and good shape, and the only problem is this broken hip, and her surgeon think she's medically stable and she has no other medical problems to prevent her from having the surgery, that could be a very good option for her to reestablish her life, her activities. Again, assuming that she doesn't have other medical problem that preventing the surgery, because every surgery has possible consequences.
Sure. Would the advanced age have any impact on her recovery?
It will be slower, but with a hip replacement, it will be way faster than leaving the fracture untreated or wait for the fracture to heal itself. This may not even happen.
Okay, thank you. Dr. Hannah, out of Greenbush, a 64-year-old male asking, they note that they have constant pain in their AC joint, their shoulder. Would steroid shots be helpful for that?
Yes, definitely steroid shot is an indication for shoulder pain, but again, it depends. He needs, a full physical exam need to be done in the shoulder and good history, so you know exactly what kind of shoulder problem he has. Is it a fracture, or is it a frozen shoulder, as we say in common English, or it is muscle? So it depends on what's the etiology of the shoulder. But if it's frozen shoulder or inflammation of the shoulder, steroid is a good option, good treatment.
Okay, thank you. For Dr. Sleeby, an 84-year-old female calling out of Flint, just looking for an explanation of hemorrhoids. How do you get them? How do you treat them?
What hemorrhoid is basically is dilated veins. The veins in that area drain the blood all the way up into the body through specific veins all the way to the liver. So any pressure on its way, on the way of that drainage up to the liver can makes the veins swollen down there and show as a hemorrhoid. It's very common problems. Majority of them are simple. They may become complicated, and there's two kinds of hemorrhoids. Generally speaking, that depends. Sorry, is she asking about the treatment?
Yes, how do they generate, but then how do you treat them as
so
well?
this is the mechanism of the way they show up. Any increase in the intra-abdominal pressure would show up there because it prevents the blood drain. Treatment depends on the degree. There are different degrees of hemorrhoids. The simple hemorrhoids, usually we try to prevent any more irritation to the hemorrhoids through stool softener, hygiene to the area, maybe using some local steroids, topical steroids. And if this did not help and the hemorrhoids are bleeding, then they need to be seen by a surgeon and they could be removed easily.
Okay, thank you. We've heard from folks on Facebook as well now. You can follow there at Ask the Specialists. And the question, Dr. Hanna, is, I have RA, rheumatoid arthritis. Okay. Does it help to take immunity booster drinks or over-the-counter immunity builders to help with that?
Again, there is not much science behind it, or there is not enough scientific data or scientific papers that study this specific thing, or over-the-counter immune boosters. Now, does it hurt? No. Does it really help? Nobody knows. There is no enough science behind it.
What's a good course of action for RA if you were seeing a patient with that?
So RA is again autoimmune disease where the body attack the joints, and it can cause destruction in the joints, mostly in the hands and the small joints, what we call it. So the treatment of it is again immunosuppression, and there's different of medication that can cause immunosuppression, which is prevent the body from attacking the joints and causing destructions. There's variety of medications. It depends on the degree and the severity of the disease. But again, there's steroid, there's something called disease-modifying agents or DMARDs, which has its own group, and there is another class with an immunomodifier, which is antibodies that's directed against the TNF or the tumor necrosis factor that cause the inflammation in a joint. So it's different modalities based on the severity of the disease, the patient age, and the degree of the disease itself. This has been, we take care of it as primary care doctors, but again, we get help from the rheumatologists who also help us with taking care of these diseases.
All right, very good, thank you. A caller out of East Tawas, 84-year-old female, asking, I have spinal stenosis. What are your views on injections? And again, sort of a bit of a descriptor for those of us that aren't familiar, Dr. Salibi, spinal stenosis.
Yes, spinal stenosis is a fairly common problem with elderly, and it causes a lot of pain and maybe problem with walking. It needs a specialist like a back surgeon, but usually we try to control the pain. I'm not sure how helpful it is. Some patients improve the pain-wise. Basically, we are trying to degrade the pain and help the patients maintain a good mobility.
And when we
That's
say
the
injection,
goal.
what kind of injection are we talking about?
It's a back injection, I believe. They try subdural injection with maybe some anesthetic agents to help decrease the pain and improve the function. As far as surgery, this is a very complicated part and needs to be discussed with a surgeon.
Okay.
Yeah.
Thank you. Caller, Dr. Hanna out of Metamora. They're 48 years of age, male person here calling and saying that they're asking what causes acute onset headaches, quote unquote, not related to stroke. It starts in the neck, rolls into the temples, and there's extreme pain for about an hour, and then pounding will follow that. What causes these acute headaches?
Well, there's so many reasons why somebody has headaches. There's different categories. There's tension headaches, there is migraines, there's something called cluster headaches, and sometimes it can be something more severe like bleeding in the skull or tumors. There's different wide differential diagnosis here. So.
And if they're having a consistent issue,
they need to be seen like by emergency room or urgent care, and probably they need a picture of the brain just to make sure there is no bleeding or no mass that's causing it, especially sudden onset.
Okay, thank you. Caller, 63-year-old female out of Bay City asking, do you recommend a pneumonia and shingles vaccine for all patients over 60 years of age, Dr. Sleepy?
Yes, definitely, but I have to correct as far as pneumonia for general population, assuming patient doesn't have other medical problems such as lung disease or diabetes or immunodeficiency. Pneumonia is recommended after age of 65. With any other medical problem that I did already say, such as diabetes, COPD, asthma, it's recommended actually at any age. And there is now a new two kind of pneumonia vaccine. One of them come with 13 and 23, and both are recommended with a specific depends on the age, which one to administer first. As the other was varicella vaccine.
Pneumonia and also shingles.
Shingles. Yes, it's also recommended for all population, and we can give it after age of 50.
Okay, thank you. A question about hiatal hernia treatment. What treatment options are there available to this gentleman out of Charlevoix, Dr.
Sure.
Hanna?
So let's explain hiatal hernia.
Sure.
Hiatal hernia is, so there is a muscle that divides the body between the lung and the abdomen. It's called the diaphragm, which is responsible for breathing. So through it, our food pipe goes through it and to the stomach, from the stomach. So the sphincter in the diaphragm get weakened, and the stomach slides up and down through that. This is what we call hiatal hernia. Treatment for it is different. There's either medication or surgery. It depends on the severity of the disease and severity of the symptoms. But usually what we call proton pump inhibitor medication, which is omeprazole or Prilosec or Nexium, this is the first line treatment for hiatal hernia. And then if they did not improve with the medication, the other step is consider hernia repair or surgical procedure. Okay. But again, it depends on the severity of the disease and if they tried the medication first, whether they get better or they failed the treatment.
All right, very good, thank you. Caller out of Manistee, Michigan, 50 years of age, a gentleman asking if you have had chicken pox before as a child, can you get them again? Dr. Sleepy? Sort of a follow-up in a way with our shingles question, but...
Yes, having a chicken pox at childhood should provide immunity, but it's still not a reason not to take the shingles vaccine, especially if they developed rash of the shingles.
Okay. Very quick question. We've got about a minute left. What medication would you recommend for Huntington's disease? Dr. Hanna?
There's no medication.
There's no
Holy
medication.
water, there's no medication.
Okay, all right, very good. Well, gentlemen, I appreciate you answering as many of these questions as we can get to. We have a few left here as well, and maybe we'll try to get a couple answered and get them up on our Facebook page. But folks, thank you for reaching out. Without you and your questions, we don't have a program. So thank you to you for joining us tonight. Also, thank you again to Dr. Aboud Salipi out of Clare and Dr. Ronnie Hanna out of Harrison, both joining us from Mid-Michigan Health. Thank you for them as well, supplying us with some folks to answer our phones today, and as well the fact that, again, we had you joining us for the program here on CMU Public Television. We have coming up next week, Ask the Funeral Home Directors. You won't want to miss that, of course, and there's more great programming coming up tonight here on CMU Public Television. Do stay tuned if you would, and yeah, Ask the Specialist next week. We'll be waiting for your calls and your questions. Jot down that number. It's new again, 844-975-3343 for future editions of Ask the Specialist here on CMU Public TV, and thanks again for joining us.
Thank you.